Good morning, everyone. On behalf of the AEDY team, we want to welcome you to our presentation today. My name is Gina Colarossi. I'm the statewide lead for AEDY, and I'm here with my colleagues today. And I am extremely excited to present our presentation today called Interconnecting Systems of Support for Schools and Communities. As you know, when thinking about this work in AEDY, we wanted to be extremely strategic in terms of our support to the field. And so today, this brings a second presentation for our AEDY team here today to think about the work that we have begun to do in building our systems of support. And so without further ado, I would like to give a little bit of background about my friend and colleague, Kelly Perales. Kelly is the co-director of the Midwest PBIS Network. And as a licensed clinical social worker, Kelly has worked both as a school employed and community employed clinician and administrator. As a partner with the Center on PBIS, Kelly has supported states, districts, and schools in the implementation and scale up of PBIS. She has provided training and technical assistance and coaching for our school leaders and community mental health providers. In addition, she has led local, regional, and state level implementers in the early adoption of interconnected systems of framework, focusing on the integration of mental health and PBIS. Kelly was the implementation and training director for the National Institute of Justice Random Control Trial Grant on the Interconnected Systems Framework, a project about schools and safety. Currently, Kelly is the lead trainer for the NIMHD, known for the National Institute of Health, their violence prevention grant called Project RISE, Reducing Inequities in School Environments. And so as you can see from Kelly's biography, we are very much in need of her hour today. I also expressed to her that this is very much just the beginning of our work in this area, and we're looking forward to continuing our relationship and connecting with her. So without further ado, I'm going to turn it over to Kelly. But before I do, I just want to let everyone know we will have a question and answer time period at the end. And so if you would kindly just put those questions within the chat box, I will be monitoring the chat box and we'll be sure to stop in good enough time to be able to push those questions to Kelly to address to our team today. And so without further ado, I turn it to Kelly. Thank you so much, Kelly, for being with us today.
Sure. Thanks, Gina. Good morning, everyone. I also want to add that I do live here in Pennsylvania, in the Hershey-Harrisburg area, and I'm the mother of 4 teenagers. So I feel like that brings, maybe more important than my professional credentials, a little bit of a backstory about why I think this work is so important. And I am happy to be here with all of you today. I am going to share a PowerPoint with you. And as Gina said, please feel free to type any comments or questions in the chat. And if there's something that I should be interrupted to address, Gina will do so. Otherwise, we will have time for some discussion and questions at the end. We only have an hour. And I know that time is going to go by rather quickly. I do want to give some other context for today. Language is really important, and I know that you all work in these AEDY programs. I'm going to talk about schools and districts and multi-tiered systems of support that go by various names. And so please know that many of the words or acronyms, which there are many, can be interchanged. And if there's an acronym that I don't clearly define, please, again, type in chat and I'll make sure to clarify any confusing acronyms or terms. The other thing to just really note is that context is important. And, you know, as Gina said, I work all across the country. It's virtual these days, but nevertheless, you know, Even things like the weather are contextual, right? We have this project in Florida and they'll tell me, oh, it's going to be cold today. But what they really mean is it's going to be like 55. I think we would agree that feels pretty nice, especially here in the middle of November. So, you know, everything depends on the situation, and there aren't typically sort of yes or no answers to questions that you might have, because the context of your program and your situation in the community in which you work is really important. And then the other thing that I would just say is that multi-tiered system of support is a framework, as you probably already know, and therefore it's not like if you do steps 1 through 7, you can kind of check the boxes and you're done. It's really a continuous quality improvement process that is iterative, and we are always learning. As Gina said, we've got some research studies that we learn from, and we also programmatically do a lot of research to practice, practice to research. In other words, we test some things out in schools, programs, districts, and feedback and input from leaders like yourselves, educators, family members, and youth are really important to our work. And so many of you might be thinking about all of these different competing concerns and priorities within your programs. And for 8 months now, we all have been wrestling with, where do we give priority in terms of supporting all students, all staff, all of our efforts as we work to provide safe, predictable, consistent, equitable environments for learning for young people. And so today we're going to talk about how a multi-tiered system of support is continually relevant for our constantly changing educational landscape, right? So some of you maybe have had any combination, even this school year, of in-person learning, hybrid learning, or virtual learning. And yet you're thinking about not only academics, but also the social, emotional, behavioral, or mental health needs of your students. And so I just want to set the stage a little bit here for some things that you probably are aware of, given that you are working with young people who are already in what I would refer to as restrictive educational placements, right? And you'll notice here that there's an asterisk where it says current. This data, these statistics, are from prior to the pandemic. So prior to COVID-19, we know that suicide among young people was the second leading cause of death. And I will tell you that a little more than a decade ago, when we first started prioritizing this idea of aligning and integrating especially mental health and education systems, that data point was that it was number 4. And so certainly this is not trending in the right direction. And we know that because of the pandemic, the suicide rates are going to be even more alarming, especially this winter. We know that 1 in 5 youth have a mental health condition that impacts both their social and academic success. And of those, about 80% do not get appropriate treatment. Therefore, the school becomes the de facto mental health provider, even though educators are not well equipped. They don't have the professional development or the competence and confidence to address mental health concerns. And therefore, sometimes, many times, oftentimes, the juvenile justice system or programs like yours become the next system default. And that is why, as you heard Gina mention, our friends in justice, so the National Institute of Justice, are interested and prioritizing this work, so much so that they gave funding to research ways to better impact this data. Furthermore, we know that in our country, we have an opioid crisis, and we have some new concerns around things like weather events, hurricanes, wildfires, things that maybe haven't impacted us in the Northeast as much as in other parts of our country. But nevertheless, we certainly can relate to the ways in which weather-related events have impacted our area. We have also been focusing more on this data point around kids with what we call internalizing concerns. So these are not kids with acting out problem behaviors who are sent to the office or expelled or suspended or sent to restricted placements, but they might be suffering in silence, having anxiety, depression, or be impacted by trauma. And so again, this data was all, prior to the pandemic. And what we know, and here's a graphic that was put together from the state of Washington, actually back in April, is that when we have these crises, public health crises like COVID-19, we are going to see mental health impact, increases in depression, anxiety, suicide. It's been on the news lately. I'm glad for that. But really the big idea is, how can we plan and prepare for what we know is coming? So SAMHSA, the Substance Abuse Mental Health Service Administration out of our federal government, has these projections, these predictions that they know will be true because of prior disasters, again, natural crises and things like that. And so how can we now start to think about how to support the needs that are coming in our communities? And we've all learned a lot, I think, in these last 8 months about public health and how to respond to public health issues. And this logic of the public health pyramid has been around for a long time. And it's the way in which things like vaccines or dealing with other public health issues have been put in place in our communities. I think in March, rightly so, there was a shift in focus in our schools to Maslow's hierarchy of needs. So kind of another triangle or pyramid of thinking about the fact that, and by the way, I think if there's any silver lining in this pandemic, it is that quickly those across our country realized how important schools and programs are to meet the needs of young people, right? Schools were the places where kids are safe, they are fed, and a lot of their basic needs are met. And so when schools had to close down in the spring, quickly everyone scrambled to think about, how do we get meals to children? How do we get technology to children and internet access? How do we ensure that they are not being abused or neglected, which is something that people have worried about as folks were hunkered down, especially in the spring. And so the last sort of triangle or pyramid that I'm going to show you here is our multi-tiered system of support logic, which is whether we're talking about academics or addressing social, emotional, behavioral health and wellness. The logic is, what do we do for all so that we can meet the needs of at least 80% of our students? And we have to use data in order to decide in our local school communities or in your programs, what do you need to put into place at Tier 1 for all to meet the needs of most? And then we will certainly have those students who do not respond to those Tier 1 interventions. And we will need to link and layer on higher doses of support in order, in a targeted way, to meet the needs of about 5 to 15% of our students who will respond to those secondary interventions. And then finally, about 1 to 5% of the population in our schools or programs will not respond at Tier 2, and we will need to layer on more intensive individualized supports. Oftentimes this means we have a whole team of adults putting an individual support plan into place for a student. And of course, we want to ensure that we are partnering with families and caregivers all along the way. And so why should we use this multi-tiered system of support framework? The literature is telling us time and time again, no matter what practice we're talking about in schools, so whether that's restorative practices, trauma-informed care, social emotional learning, bullying prevention, you name an initiative or a practice, if we're not using the logic of multi-tiered systems of supports, chances are we're not going to be effective. So we know that multi-tiered systems of support are essential for accurate, durable, and scalable implementation. They're grounded in that public health logic of prevention and a continuum of evidence-based interventions that are matched to the data. We know that it provides a way to efficiently support those students who are identified with need. And so this graphic here comes from McIntosh and Goodman's book around alignment of academic and behavior multi-tiered systems of support. But essentially, the big idea here is there are these core features of MTSS. And so no matter the practice or the initiative that we're working on, we want to use these core features. We want to have teams who have sort of the stakeholders represented in your program or school, that they have leaders who have authority to make decisions, that there are coaches who can support teachers and others to install the practices. Again, that school community data is used to determine what the need is, and that interventions or practices are put in place to fidelity, and that we're monitoring the outcome of those interventions to make sure that they're even effective. And we also want to prioritize the use of universal screening. So whether that's, vision and hearing or health screening, screening for reading or math, or screening for social and emotional concerns, that type of data can help us with triangulating the other data points we have to make good decisions. And all of this should be done with not only professional development, but ongoing technical assistance and coaching. And so again, whether you're talking about addressing substance use and abuse, the impact of trauma, or social emotional learning, we want to use those core features of the multi-tiered system of support. And furthermore, we have to think about the ways in which we can align and integrate, especially our social emotional behavioral health initiatives. Otherwise, we're not going to be efficient or effective in our efforts. And so throughout the presentation, you'll notice that there are links to other resources. And so I really encourage you, if you find any of this information helpful, to use these resources in your efforts to support the students in your programs. And so sometimes it might feel like in your program, you are trying to address all of these various related initiatives. Sometimes initiatives come to us because there's some sort of a mandate or legislation that is passed. And so there's sort of that, you must do X, Y, Z. Here in Pennsylvania, school districts are required to have a bully prevention framework. They are required to address suicide prevention, et cetera. And so therefore, a lot of times schools or districts kind of say, all right, how are we going to meet this mandate? And other times there are data points to suggest that a district or school should take a deeper dive in something like addressing equity and cultural responsiveness, or thinking about the mental health of their students. No matter how these initiatives get started, if we are not thinking about the ways in which they intersect, we might end up kind of being a mile wide and an inch deep. In other words, we might have a multitude of practices and none of them are highly effective. And so positive behavior intervention and supports is a multi-tiered system of support that has been funded through the Department of Education's Office of Special Education Programs for over 20 years. It's actually the longest funded federal initiative out of the Department of Education. And in large part, it's because there is evidence, research, data to tell us that it is effective. And so this is why we have used this framework, which in the 90s started out as a way to address discipline and behavior in students. It is now expanded to incorporate those kids with the internalizing concerns, the social, emotional, behavioral health and wellness and mental health of all students. And so, it does follow those multi-tiered system of support core features. And here is a little bit about the evidence and the data behind this framework. And, certainly I encourage you to check out the literature if you're interested in reading more about the ways in which it improves student outcomes, it improves teacher outcomes, and reduces exclusionary discipline. So that includes not only discipline referrals, but suspensions and restraint and seclusion. As I mentioned, we have evolved, we have learned, and we have now expanded the logic in a way that also includes community partners, those in the community who are addressing especially the mental health of our young people. We refer to it as Interconnected Systems Framework. The only reason it has sort of a different name is because we wanted to study it. And so you will find lots of materials online that are free. They're in the public domain. If you go to pbis.org, you will find 2 electronic books. One was published in 2013, and a second was just published here in 2019 on the ways in which programs, schools, districts, states can align and integrate their systems in order to better meet the needs of all students. And so again, the way in which those core features have been expanded is we want to not only look at school data such as attendance, discipline, and grades, but we also want to look at other school data points like how many students are or were, when we were in virtual learning, going down to the nurse because they have headaches, stomach aches, or other somatic complaints. How many students aren't coming to school, but it's because they are struggling with anxiety and depression? And what other community data could we look at? So, right now we know that families are taking kids to the emergency room when they have a mental health crisis. Or what do we know about the risk and protective factors in our communities? Are you all looking at the PAYS data? So that's the youth survey that is given or available to give to students in grades 6, 8, 10, and 12. And that gives us, from a youth's own perspective, data around their perceptions on risk and protective factors, whether or not they're thinking about harming themselves. And other ways in which the core features are expanded include that regardless of whether a community clinician or a school personnel are delivering interventions, we want them all to be monitored in the same set of teams. We want community partners on our teams within our programs and schools. And again, we need to make sure that not only are we providing training, but we're also following up with coaching. So a lot of times schools are providing things like mental health literacy and even suicide prevention training. That's fantastic. And what we know is that training alone is not necessarily going to lead to a change in practice or the way in which teachers are able to use those skills that they learn in the training. And so Gina mentioned in the introduction that we have concluded our first random control trial. This was a large study that involved 24 elementary schools in 2 very large school districts in the Southeast. And, upon conclusion, they're still mining all of the data. We had data on over 30,000 student records. But what we know is that when done well, if we put this framework of an aligned and integrated system in place in schools, we're more likely to see kids being identified who need additional support and connected to those interventions rather than being kind of in that discipline pipeline, so to speak. And we know that when students are connected to interventions, sometimes lower level interventions that don't take a lot of adult time and resources can be effective in meeting their needs. And so we really feel like we need to focus on deliberately integrating our efforts in order to address the social emotional competencies and meet the needs of all students, especially when in school. This is actually a series of pictures that I took in a school in Pennsylvania when taking a group of teachers kind of on a field trip in their own building. Because what you see here is posters on walls inside classrooms and in hallways and other areas that depict various initiatives or programs or practices that they were putting into place. And so certainly there's a PBIS matrix, which is where we say, what are the overall expectations and what does that look like, sound like in various locations of the building? There is a poster that represents the bully prevention plan that they had in their school. There is a poster that is from the social emotional curriculum that they were using. And then there are, of course, sort of the teacher's own classroom management strategies or rules. And the truth is that these posters have similar words on them, but they're not the same. And so if you're teaching the social emotional learning curriculum on Monday and the bully prevention lesson on Tuesday and the PBIS expectations on Wednesday, it gets pretty confusing pretty quickly for kids and adults to know which words are we supposed to use when, and how can there be transference and generalization across settings. And so again, and you saw a similar slide a little bit ago, how can we align and integrate our initiatives and practices in order to see transference and generalization of skills, being able to have a similar language and common expectations, and more likely see improved results and greater impact for all students. And so in these technical assistance briefs, you will find details about how to get started with the process of aligning practices and initiatives, especially those that are non-academic. And this will help lead you in a way in which you can be more effective and efficient. We sort of call that working smarter, not harder, if you will. And again, you're going to have to think about your data. You know, what are you currently doing? And how's that working for you? And is there anything that you could align right away? Is there anything you should stop doing because it's inefficient and ineffective? And this needs to be done, again, using that multi-tiered logic. So here's an example of, again, this is we call this the PBIS matrix if you're not familiar, but it is, how can we set structure and routines and procedures and deliberately teach expectations to students so they know what it is they're supposed to do. A lot of times if you ask kids, what are the rules at school, they'll tell you what they're not supposed to do, but they're often hard pressed to say what it is they should do instead. And when schools first get started with PBIS, they're really good at establishing these routines and procedures, and that includes things like if you're in the bathroom, how many pumps of soap and paper towels are you supposed to use? And you know what? That's important, but we can also tie in whatever skills you're teaching. So whether that's from a curriculum or you've made up some pro-social or problem solving or coping strategies, those should be embedded into that matrix so that, again, it's clear for all students and adults across settings what the expectations and the skills are that should be used. This graphic depicts what we call a teaming conversation. The big idea here is that when you meet, and depending on the size of your program, you might have one team that meets to look at data and problem solve concerns that you have about your students. But chances are at some point you're going to talk about what are you doing for all kids at tier 1? What are you doing for those kids who fall into that targeted range at tier 2? And what are you doing regarding those kids who need those intensive individualized intervention? And so the big idea here is that you do want to be looking at data, having a problem solving process where you can sort of say, what interventions do we have in place? How many students are in each intervention and how many are responding? Are we implementing those interventions to fidelity? Do we have parent perception or caregiver perception on if they're noticing any differences at home. And by the way, if kids are in virtual or hybrid learning right now, it's even more important that we collaborate and partner with families and caregivers, because we have to work together as kids are at home and we're trying to help them with academics and all of those social, emotional, behavioral concerns as well. It's important to think about how you might be using anyone who's in sort of the role of a clinician. So school counselors, social workers, psychologists, other professionals who are either employed by your program or school districts or partners from the community. Again, it's important that these leaders, no matter where they're employed from, be part of your teaming conversation. They can bring their expertise and provide consultation. They can also coach teachers in how to build up their competencies to recognize any non-academic barriers to learning, how to know if a student might need additional support and what to do about it in the classroom, as well as what not to do about it. And clinicians then can also coordinate your tier 2 and tier 3 interventions, as well as facilitate those higher level, more intensive, perhaps even small group interventions and individual interventions. All of this should be done with support from leaders at the executive level. And that is because we need those people in positions of authority to make decisions about how people spend their time, how dollars are going to be spent, any necessary considerations for changes in policy. And that is the way in which we're going to be able to support in your programs or in schools the necessary changes for better outcomes for students. And so again, there are tools available that might be helpful to you if any of these ideas resonate with you today, and you're thinking about how you could begin to have conversations about better supporting the students in your program, or even thinking about how you might get them ready to go back to their homeschool environment. And so again, what types of data are you already looking at to inform your decision making? And what might you consider as you expand your data in order to better inform your decisions? Because if we're only looking at data within a program or school, we're missing lots of other information that could inform our decision making and help us make better decisions early on. Because if we have a group of students, more than 20% of students who fall into any one category, we should really be dropping interventions down into tier 1 and doing something for all. All right. So again, if you have more than 20% of your students in any one category, you should be doing something, installing a practice or intervention at tier 1 for all. And so again, whether you're talking about coping strategies for managing stress, so here's an example of that, you want to put those tools, those skills right into what you're doing for all. So even if you don't have some sort of matrix or set of expectations that's posted for all kids, you could find ways to make sure that whatever you're teaching to students, all kids and adults in your setting know what the words are, what's going to happen. So in this example, and I know lunchrooms have changed drastically this school year. So obviously this example was created sometime before March. If kids are going to, for example, be able to go to an alternative place to eat their meal, everybody has to know that, and something has to be set up. An adult has to be available for supervision, etc. Right? But it can be taught to everyone. Here's an example around bully prevention. This is Scott Ross's logic. Again, if you're not familiar with his work, it's free and in the public domain. But the big idea here is that if we teach everyone to be respectful or tell others if they've said or done something to upset or offend us, then we don't have to worry as much about kids being bullied, because we're teaching kids to stop, walk away, tell someone that it's not okay. And if none of those strategies work, then get an adult to help you, right? And again, this is something that can be taught to everyone. And we want to make sure that it is built right into everything else that we're doing. Social media. And right now, all kids are using a lot more technology. They're on computers and phones and iPads and whatever, a lot more time every day. And so we might need to give some strategies for how to navigate all of that. And we know that electronic aggression, which is a term that the Center for Disease Control identified as a problem for young people, is something we need to pay attention to. And so how can we, and by the way, if you look at this example, I mean, these are things that are good for adults, especially right now with everything that's been happening in our political climate. Check your feelings. Pause before you post something or send an email, for example. Double check, is what you're posting true? Is what you're sharing true? Consider how this might, make other people feel. And so these are things that we can teach deliberately, and then we'll better be able to monitor the impact that it might be having. This is an example of something to share with families. Again, as kids are spending more time at home or joining school virtually or in a hybrid mode, how do you translate your expectations from your program to kids who might not physically be there? How can you help families understand what the rules and routines and procedures are? How can you help them help you with the students in your programs? Here's an example of one for hybrid learning. There is one for virtual. I didn't put it in here because none of our examples are perfect, but that one had something about making sure that you're always on camera. And I will tell you, I know from providing training to adults over these last 8 months, not everyone's going to be on camera. Some of you aren't on camera because it impacts your internet broadband and you'll lose your connection. Some of you aren't on camera because there's distractions in your background that you don't want to disrupt the learning. Some of you aren't on camera because you don't feel comfortable with it. And so if we as adults aren't going to be able to ensure that we're always going to be on camera, we shouldn't be asking that of our students either. And so we have to find other ways to engage students and have them participate, whether that's using chat or other ways they can let you know that they're present and that they're engaged in the learning. This is an example of something called a daily progress report. This is part of the intervention check-in, check-out, which is often the most common used intervention at tier 2 in a multi-tiered system of support for social emotional behavior, or PBIS. It's because it is a highly effective intervention that requires very little adult time or resources. And it's all about giving kids more interaction in a positive way with adults and more opportunities for practicing the expectations. This report here is used for progress monitoring, and it's a way for kids to learn to kind of self-monitor their own behavior. And the other good thing about it is we can link and layer other skills that are being taught in higher tier 2 interventions. And again, that way, the student, the teacher, the parent or caregiver knows what the skills are that are being taught. And again, we can use this tool for progress monitoring. So there's just, again, more examples in here for you. We have lots more of these available on our website. And so I encourage you to check out those examples or more about how to use this intervention, including there's a technical assistance brief for how to use it in a virtual setting. And by the way, these daily progress reports, these are examples of kind of a paper version, but there are also electronic versions that are available. Just want to say a little bit more about kind of having a continuum of interventions. This is a depiction of tier 2 or targeted small group interventions. The big idea here is that there might be interventions that could be taught by any adult in a program or school, reteaching school-wide expectations, teaching basic social skills or coping or problem-solving strategies. all the way up to intensive evidence-based interventions that, even if they're done in a group, are best delivered or facilitated by someone with a clinical background. And so you have to think about, again, what are the needs of your students? How do you decide what type of intervention is best going to match that need? And who is going to deliver the intervention that you select? And so there are tools and resources that are available, as I mentioned, to help your executive leaders and your program team to decide, is what you're doing right now working? So what's your current status? What practices or interventions do you have in place? How many students are benefiting from them? As I mentioned, are there any you should stop doing if you're allowed to? And how will you decide where to go from here? And so it might involve something like this initiative inventory, where you really kind of map out, are you using interventions that are evidence-based? Have you spent a lot of money on them? Do you know if there's been any impact? Do you know if they've been implemented to fidelity? Have you provided not only professional development, but also ongoing coaching? And that will help you decide the opportunities you might have for aligning, integrating, or eliminating any of your initiatives or practices. This is called the Hexagon tool. This comes out of the National Implementation Research Network. It might be a way for you to have some conversations with your team about where do you go from here. And the big idea is, before you start anything new, you should assess whether or not you have a need for that thing, intervention, practice, initiative, program, whether you have a fit in your current initiative. So like we just talked about on the last slide, do you have the capacity to implement? In other words, are you going to be able to get people trained and make sure that you can sustain whatever it is that you're going to put in place? Is there evidence that it matches your need? Is it usable? Is it going to have social validity among the staff in your program? And do you have available supports, coaching, professional development, etc.? The reason this says it's new is NERN recently updated this tool, but it is highly effective in leadership groups for anything that you're putting in place in a program or school, whether that's an academic curriculum or an SEL curriculum, for example. I want to share with you now an example, and this comes from an alternative school in Pennsylvania. They were involved in a project that was funded through a grant that was a federal grant awarded to Pennsylvania. I'm going to go with about 6 years ago now. It was a 5-year grant, and there were a couple of other districts that participated in the project, but this was an alternative school. And they were using the logic that I've described for you today of an interconnected systems framework. They had PBIS in place, and they also were partnering with community partners in what's known as system of care. So they had partners from mental health, juvenile justice, child welfare, and other formal and informal community partners. And I know there's a lot of acronyms on this slide, and I apologize for that, but the big idea is that over time, so keep in mind, things aren't going to happen overnight. And remember what I said at the beginning, this is a process. It is iterative. In other words, put something in place, monitor the data, see if it works, adjust, right? Continuous quality improvement. And so year over year, not only did they work on improving their implementation fidelity of positive behavior intervention and supports, but they also, based on their data and community data, installed additional interventions based on what they were seeing from their students. And so they used a social skill curriculum. That's what the SPO is. And you can see at the, oh, I'm sorry, that you can see at the bottom, their school police officer joined their team. They had a SAP program, student assistance. They started using aggression replacement therapy. And actually, the school resource officer in this instance was the person who was trained to deliver that intervention. So he facilitated groups. They used Renew, which is a individual person-centered planning process that is driven by the student. So it's meant for adolescents. And you can see that year over year, they added some of these interventions based on their data. And this is a representation of some of their data. And what you notice here is that they reduced their restrictive placements out of this alternative school from the start of the project to the end. And I will tell you that to me, this is really powerful data. They had 10 students in their alternative program at the start who were in restrictive placements like residential treatment, drug and alcohol rehab, psychiatric hospitals, and detention centers. And over the course of the project, they reduced that to only one. So they were able to bring back kids from restrictive placement and prevent additional students from going into restrictive placement because of their efforts. And so I think that's really powerful. And the other thing that I want to say about this notion of data is that sometimes people get really hung up on how do we progress monitor when it's, not academic data. So if we're talking about kids with anxiety, depression, have experienced trauma that's impacting them at school, what data do we progress monitor? Well, depending on the presenting problem, that's what you progress monitor. So what we have to focus on is whether it's in your program or in a school setting, we have to help kids function in school. And so whatever the presenting problem is, that's what we progress monitor. And so in this example, it was attendance. This was a student who was struggling with anxiety and they were missing a lot of instruction. And so the clinician who was using the school database for entering the data was monitoring in attendance as one of the data points while the student was receiving the intervention. And so again, I think we have to kind of demystify, especially mental health interventions, in order to think about how we help kids be successful in programs in schools. And so, Gina, I noticed that there were some things coming up in chat. Because I'm sharing the PowerPoint here in this way, I couldn't see that. So I'm going to stop sharing right now so that we can open it up for some questions.
Thank you, Kelly. I found myself here nodding behind on the other side of the camera here, just in complete affirmation of the information that you provided today. So if anyone has any questions, please put them in the chat box. We have approximately 12 or so minutes remaining in our time here, and we want to make the best use of our time with Kelly. So if you have any questions, please put them in the chat box. I did provide the PowerPoint. And as I had told folks earlier in the presentation, we will make this presentation accessible, and then we will be posting it to our Schoology site for AEDY, and we will also have it on our patent YouTube channel. So Kelly, one of the things, you're getting many thanks here through the chat box. One of the things that stuck out to me was a statement you made early on, and it was some of the work that our team has begun to reinforce within the field. And the statement you said is, if we are not using an MTSS framework, we will not be effective. And so, there are certain statements that we write down and things that stick with us in time. And so I want to really emphasize to all of our participants today and those that will be listening later on recording that if we want to be effective for kids, we really need to go back to the frameworks that we've established this year. So Kelly, every AEDY provider established an MTSS framework this year. And it was the baseline, exactly. I'm smiling too. It's the baseline of our work and the beginning point, or maybe revision point, for some of our programs have had frameworks in the past that they've used, but it required everyone to go back and reconsider. And with the resources and the research that you've provided today, I know I'm going to be going back to and looking at some of the more effective practices to push out to our field today. So if anyone has any questions, please feel free. This is our open mic time with Kelly.
I'm also going to put, again, even though you have access to the PowerPoint, the two websites that I would point everyone to. All of the material that I covered today, you will find more detailed information on the website. And there are lots of resources, again, if you're in hybrid or remote learning right now, that can help think about, okay, this is all fine and good if we're in our program and everybody's in the room together, but what do we do now? So you'll find some good guidance around that as well.
Thank you. And I will add the PBIS as well as the Midwest PBIS site to Schoology. And thank you, Kat, for adding the exit survey again to to all our folks today. So if you're looking for any credit from today, we do have the link now posted in the chat box. So Kelly, this is the beginning of our work in this area. And so I know I'm going to be reaching out to you, post some of our conversations with our AEDY programs and our LEAs, because we're going to be reinforcing the MTSS work specific to PBIS with all of our programs and LEAs that are sending to these AEDY programs. So you continue to get more thanks. Anyone have any questions? This is one of our last calls. We'll stay on a few more minutes for anyone who might want to ask some questions. Good question there. Did you see the question come through, Kelly? So what is an LEA? An LEA is the local educational agency. It refers to a school district. We apologize again for the acronyms. It could also refer to a charter school in the state of Pennsylvania.
Mm-hmm. No reason to say duh. We all have those things.
We'll wait maybe 2 more minutes or so for any last minute questions. I know it was a great deal of information for everyone to take in, and they're processing, Kelly, all the work that we have done with our teams to support our AEDY students, not only within their LEAs or their school districts and charter schools, but also within the AEDY programs, because it's one, as you've indicated, interconnected system of support. It's the same child. And so we're actively working towards that with our field to ensure that all these pieces of programming are in place and support and positive support, keeping our students in school. More thanks. Okay, so what I think I'm going to do is I'm going to actually, in not such an open setting, Kelly, really talk to some of our providers and our school districts and charter schools, and I'll come back with any questions that they may have had or clarifications, including our team. So we meet after every one of our presentations as a core AEDY team to kind of think about our next steps and the work that we're going to continue to support. So I can't thank Kelly enough for her work, certainly within the field. I know, just speaking personally and professionally, I could not have done a tenth of what I did in my AEDY program or in my school district without Kelly's support in the past. And so I thank her immensely today for her knowledge, and for her continued work for all of our children, because I know I couldn't have done it without her. So I hope each of you has been able to take something away from today that will actively impact your program and your students. So again, Kelly, I thank you, and I can assure you that our AEDY team we will be in touch.
Okay. Take care, everyone.
Thank you.